I fell in love with oncology in medical school. I went to my third-year rotation. I had a wonderful mentor, and we were in the oncology unit. And I saw the strongest bond that she formed with her patients and their families. Oncology is tough for everybody, not just for the patient, but for everybody that the patient knows. It's a life-changing thing. And being able, I think, to be there for patients and families in that tough time, it's so rewarding. Another thing that I love about this field is that there's hope, There's so much hope. There's so many changes. I mean, even in the time that I went to medical school to now, the options that I have to offer my patients are just changing monthly. When I know that these changes can make a difference in how long my patient lives or how good they feel, or I can offer them a treatment that works as well as chemo, but the side effects are significantly better. I mean, that's quality of life right there. The fact that we're figuring out that the immune system can play such a big role in controlling tumors, and that we don't only have to rely on cytotoxic chemotherapy, but that we can use our own immune systems to take care of them, it's great. And I think it's going to continue making a big difference in how we treat cancers. I think this field's going to a great place. And the best thing about immunotherapy is that we're starting to see this long-lasting responses of patients who had stage 4 advanced disease, who before, even with our best intentions, we couldn't have them have a long survival. With immunotherapy, that's all changing. I think we're very lucky at Florida Cancer that we have a lot of research trials to offer patients. We have a DDU unit, which is a drug development unit, also in Sarasota, where we can do phase 1 trials. So we're running out of options and patients are still doing good, and we still want to give them something to try to control the disease. I think being able to do that through Florida Cancer is great. I have many patients that sometimes come alone, to their appointments, and if I am talking about changing therapy, or if I'm talking about a progression or any changes in their scans, I always call them and encourage them to bring their families. When families are involved, it's great. They are listening. Each person maybe captures a piece of the information, and then I try to put it all together at the end. They know how to reach me very, easily. I'm always happy to talk to families on the phone if questions come up after they leave, or have them come back to see me. So I think having support from family in this journey or dealing with this disease is crucial, and I love interacting with them. Being there in the hard times, the good times, celebrate them, to clap when they're done with the chemo, to be sad when things don't go as we wanted, all that, it's a blessing. It's a true privilege to do this. I love my job. Yeah.